Good day, I am Rain De Leon from NUST BSN3F, and as for today, I'm going to perform a tracheostomy care for the patient. For the goal, the patient exhibits a tracheostomy tube and site free from drainage, secretion, and skin irritation or breakdown. For the equipment, we need to check for bedside table, towel, tracheostomy suction supplies, sterile tracheostomy care kit if available. Be sure to collect supplies listed that are not available in kit, or two sterile 4x4-inch gauze pads, sterile cotton tip applicator, sterile tracheostomy dressing, pre-cut and sewed surgical dressing, sterile basin, small sterile brush or pipe cleaner or disposable inner cannula, small brush, roll of twill tape, tracheostomy ties or tracheostomy holder, scissors, pulse oximeter, stethoscope, clean gloves or two pair of clean gloves, mask, goggles or face shield, hydrogen peroxide, and PNSS or sterile water. Now, we're going to demonstrate the tracheostomy care. Number 1, we need to bring necessary equipment to the bedside stand or overbed table. Number 2, we need to perform hand hygiene and put on PPE if indicated. Number 3, we need to identify the patient.
Good day, ma'am. I'm Brenda Leon from NUST and I will be your student nurse for today. I would like to ask if you're Miss Francesca Neves.
Number 4, close curtains around bed and close the door to the room if possible. Number 5, we need to determine the need for tracheostomy care. Number 6, we need to explain what we are going to do and the reason to the
So, ma'am,
patient.
ang gagawin po natin, nililisan po natin yung tracheostomy tube nyo. Then, i-check din natin yung area para ma-ensure po natin na walang skin irritation or inflammation.
Number 7, we need to adjust the bed to a comfortable working position, usually below height of the caregiver. And we need to lower the side rails closest to the nurse. Then if the patient is conscious, place him or her in a semi-Fowler's position. Then number 8, we need to check for lung sound. Number 9, place the towel below the trachea side covering the neck and the chest of the client. Number 10, we need to put on face shield or goggles and mask. Number 11, we need to prepare the basin and cleaning solutions. We need to mix the sterile water or PNSS and hydrogen peroxide in one basin. Be sure it will fill 0.5 inch of the basin. Then we need to add another PNSS in another basin that will fill at least half inch. Number 12, we need to perform gloving. Then now we're going to clean the tracheostomy. We need to remove the oxygen source if one is present, stabilize the outer cannula and faceplate of the tracheostomy with your non-dominant hand. Then, grasp the locking mechanism of inner cannula with your dominant hand. Press the tabs and release the lock. Gently remove inner cannula and place it in first basin with PNSS plus hydrogen peroxide. Let it submerge there for a few minutes. Then number 14, simultaneously, gently slide the tracheopad or dressing downward and discard. Check for some exudates or drainage, skin breakdown, irritation, and inflammation. Number 15, we need to clean the inner cannula of the tracheotube using the prepared PNSS plus hydrogen peroxide and use brush to remove the solidified or sticky mucus. Then, we need to rinse using the second basin with PNSS only. Then we need to dry the inner cannula using sterile gauze or pad. Reinsert it back to the tracheostomy tube. Be sure it is properly locked. Then number 16, we need to dip cotton tip applicator or gauze sponge in cup or basin with sterile saline and clean stoma under faceplate. Applicator or sponge only once, moving from stoma site outward. Number 17, we need to pat skin gently with dry 4x4 gauze pad. Number 18, we need to slide commercially the prepared tracheostomy dressing or pre-folded non-cotton filled 4x4 inch dressing under the faceplate. Number 19, we need to check the feet of the tracheostomy collar. You should be able to fit one finger between the neck and the collar. Check to make sure that the patient can flex neck comfortably. Number 20, we need to remove gloves, then assist the patient to a comfortable position. Raise the bed rail and place the bed on the lowest position.
Ayos na po natin yung position niyo.
Number 21, we need to remove additional PPE if used. Then perform hand hygiene and documentation. 22, reassess the patient's respiratory status, including respiratory rate, effort, oxygen saturation, and lung sound. And that's it for our demonstration for tracheostomy care for the patient. Thank you for listening. Stay safe and God bless.